Pascal-Julie Robinson. Thank you very much for taking your time.
Thank you.
It's a pleasure talking to you.
Pleasure for me.
Before we dive into the questions, I wanted to ask you to shortly introduce yourself and tell us what you are doing exactly.
So I'm an osteopath since 20 years now, but it passed so fast. And I'm mainly working with babies and kids. I would say that for the last 15 years, I was working mainly with newborn babies. So my patients are really from 0 to 3 months. And I'm also having like older kids, teenagers, no adult anymore. And I'm teaching mainly in Montreal. So the regular program in Montreal, and I'm teaching here at the OSD and some other places in Europe since I would say 10 years now.
Wow,
yeah.
That's quite a CV. You are a teacher and an osteopath. How have you personally benefited from these overlaps?
I was more a teacher than a researcher, so I did my thesis project when I finished my studies like 20 years ago on babies also. And then I started already to teach at the beginning as an assistant. And I really enjoy teaching because it's really a way for me to learn at the end. Because when you teach, you're trying to explain to the student, to make some like, if they don't understand, you're gonna make it easier for them to understand. So it always asks you to keep things simple at one point. And so you're learning as you teach. So for me, this is really a good opportunity to evolve and to have greater experience in my field of practice, I would say. And in my everyday clinic, for sure, I'm learning every day. So because I'm still working in my clinic, I can give those information to my student, and then when I go back to my clinic, my work is always different after a teaching session. So this is a two part of my job, and I think it's amazing to have the chance to practice as a clinician and as a teacher. So yeah, I'm very lucky. Finally.
That makes total sense. And you said that you've started treating children or writing about children quite early in the stage of your career.
Yeah.
So what exactly is it that fascinated you about pediatric osteopathy?
This is a good question. What fascinated me, I would say that at the beginning it was not my plan to treat babies or kids. I was more interested in sports therapy. So you see that like I started wishing to see, okay, I'm going to go for athletes, sports therapy, and then finally I'm working with babies who are, by the way, little athletes because they're moving a lot, they're running everywhere, so they're like maybe that the two fields of practice are linked together. And I started with babies because I did my research project on babies. It was a suggestion of one of my teachers. So she introduced me to a research. Somebody approached her to do a research, and she did not have the time to do it. So she proposed the project to my colleague and I. So we jump into that project. And I discovered at that moment that treating babies was really special and wonderful. So I just keep in that direction.
Sounds amazing. And from your personal experience, what would you say is the most important aspect when treating children?
I would say, and I was teaching this morning, and I was telling the student that to develop a good contact with the kids, it's mainly your main goal as an osteopath. Because even if I want to show you the most complicated techniques and to do this and this, if you don't have the contact with the baby, you're not going to be able to place your hands on him or her. and you're not going to be able to work on him easily. So I would say that the contact with the kid, it's so important, and I've learned that really early in my practice because of one of my teacher who was like, she was talking to the kids, she was explaining to them, even small baby. So I say, yeah, that can make a difference. So if you can have the good contact, you're going to be able to do everything they need. And that was the case with the baby that I've just treated before the interview.
Mm-hmm.
Mm.
And what importance do you give words in the treatment, especially if the mother or the father is in the room?
I always tell my student, like, your client or your patient is the baby.
Mm-hmm.
So even if this baby is 2 weeks old, 3 months, 2 years old, or is a teenager, is your client. So you really have to discuss with your client, talk to him, explain what you're doing.
Mm-hmm.
And for sure, little baby don't understand all of my language, but they're gonna understand the intention behind the words. Because you want to explain to the parents, but you cannot have a discussion with the parents while treating the babies.
Mm-hmm.
So if you're explaining to the babies, the parents will understand what are your goals, what are you doing, and at the same time the baby is understanding the meaning of your, not the meaning of your words, but the meaning of your intention. And this is for me a huge difference.
Mm-hmm.
She was like the little baby we just treated an hour ago. She was only 2 months, but she was reacting. When she was complaining, I was telling her, no, it's gonna be good. You're gonna feel free after that. You're gonna feel good. And she was calming down. So they really understand really much more than we thought as adults.
You've just mentioned the treatment that you've been having for the last couple of minutes during the class. Can you tell us a bit more about your experiences?
It was really nice. And I always say that as an osteopath, I'm treating a baby in front of a class, it's a big challenge for the baby because there's a lot of people in the class. So it's many pair of eyes looking at you. There's a lot of energy. The baby, for sure, she's seeing like new faces everywhere. It's a challenge for the parents because as a parent, you want your child to do the best. And sometimes they're gonna cry, they're gonna complain, and for the parents, say, oh, is my kid's gonna be okay in front of all those people? And for us, osteopath, you say, okay, if she cries, if it doesn't go well, there's a lot of people looking at me. And every time I'm asking the student, okay, so for sure, just put your mindset on the baby. Think of the baby that you want him or her to feel great, to feel relaxed. You want to help me release the tension. So if all those energies are with the baby, it's making a huge difference. And for example, in the class, I think we're 22 students. So with the mom, I'm there, so there's a lot of people, but they were really calm. Nobody was talking, and I could felt the energy that the energy was calm but good. So it was exactly if I was alone with the baby and the mom in my office. At one point, I just forgot they are there, but the energy is always amazing, and it's always helping me so much when it's a group like that. So it went really well, and at the end, she was so relaxed. And when we have kids in front of a class, they always show a lot of things. So they show some movements, some postures. So it's really nice when we have when we can have some kind of those experience.
From the energy that I could feel from the class, you do give the intention quite an importance. Is that right?
Yeah. Because at the end, it's all about intention. one of my teachers was always saying, don't go treat a patient. You want to do him well. You want to do him good. You want to make sure that this person's going to feel better after the treatment. So it's really about the intention. And it's my intention, but in that case, the intention of the baby. Because I'm not the boss. The baby's the boss. For example, at the beginning, I wanted to work on her diaphragm because she had digestive issues. And she was 2 months old and she decided, no, you're not going to work there. You're going to work on my lower back. So she was taking a posture, she was doing some movement and showing me exactly what to work on. And I follow the lead that she was giving to me. And finally, I think that the lower back was the main key, more than the diaphragm. So my intention, her intention, all that together we can realize that it's possible to do something great for that person.
Do you think, or would you recommend that every osteopath should treat babies, or should at least treat a baby once in a while?
This is a really good question, because you know that there's a lot of osteopath, or maybe younger osteopath, they don't want to treat babies because they say, no, they're going to cry. I don't know what to do when they're crying. And they're small. How can I adapt my technique? Too complicated. But you know, when you're treating babies, you're learning a lot about your palpation skills. You're learning about your observation skills, because they're not going to say, okay, my problem is my lower back today and I have pain in my left lower limb. No, they're going to show you. You're going to have to guess, you're going to have to palpate, you're going to have to adapt. So it's a really good way to learn, and then to be better with your adult client, with the guy who's doing football, with the pregnant woman. So yeah, you developed a lot of skills working with babies, and for myself it's more simple. I have so much fun working with them, because if you pay attention, they're going to show you everything by their posture, by their movement, by their mobility, placing one hand here, doing that movement. It's amazing how they communicate, and way better than adults. I can assure you that.
Now, because you've been talking about your personal development, I wanted to ask you, what have been the greatest successes in your development of your treatment as an osteopath?
I would say to be in the present moment. Because you know, sometimes because I still have some adults in my in my office, like maybe 2-3 adults in a week. It's not a lot, but I still have some adults, and because like it's so easy to communicate with them, say, okay, where is your pain? Since when? When that car accident happened? So you're not a lot into the palpation, into the listening of the basics needs of your patient, and sometimes we just go in our head. So you're treating your patient, and the typical is doing your grocery store list while treating. With a baby, you cannot do that, not at all. You have to be completely there in the present moment, observe every little signs from the position of the head, the body, the hands. So when you're with them, your mind is completely with them. So it's helping you to be really in the present moment. So at least a bomb can blow up in another place, in another room, and you're not going to be even aware of something happening, because you're really focused on them. And for me, it was It was really good because when I was younger, I would say that I was everywhere at the same time because I wanted to do a lot. I was studying, I was starting my practice, I want to do this, I want to do this, I want to do that. And when you're treating baby, you're focusing, you're in your center, and whew, what a relief. So it's like doing yoga or meditation every day. So I'm really lucky to work with them.
That sounds amazing, an amazing answer.
Yeah, it's like treating baby, you don't need to go to therapy after. Or maybe you should, but they're treating you at the same time for sure.
So after all, treating babies would be the best therapy for osteopaths.
Exactly. And you're gonna become like better osteopath with your client for sure.
Julie, it's been a pleasure talking to you. Thank you very much for your work.
Thanks to you.
And your time.
Thank you. Bye-bye.